Hey guys, here with this video, what we're going to work on is getting rid of that nagging elbow pain, whether it's on the outside of your elbow, inside of your elbow, golfer's elbow, tennis elbow. Epicondylitis is the medical term we use for this type of inflammation diagnosis, but what we're doing is we're going to try to push some of that tissue around to get new blood flow. A lot of times with these itises, when it comes to the elbow area especially, is these tender areas on the end of the elbow where a lot of these muscles attached to for the extenders or the muscles for the flexors attached to. That's where they see the most force that creates this stress and this pain. So to help with that, we're going to use a kettlebell, or you can use a dumbbell, and we're going to use a lacrosse ball, a tennis ball, some type of ball that you can grasp. You can even just use a towel if you don't have this laying around. So what we're going to do with this one is we're simply going to lay our arm down on the bench. You can use a table, whatever you have at your disposal. And then we are going to put the kettlebell right on what's the most tender area. Now, probably looking at this and cringing a little bit, like that probably doesn't feel too good. And it should be uncomfortable. The idea is that we're pushing down and getting some pressure on where that tissue is dysfunctional. We're grabbing something. So I'm grabbing the ball to get those muscles to engage. And all I'm doing is just moving my wrist back and forth. I engage those extensor muscles, and now I'm pushing that tissue through some range of motion, getting it to slide underneath all of that force that's on the kettlebell. Now this is 35 pounds. You want something that's going to be slightly uncomfortable. You know, don't go and grab like a 53 or a 70, or try to deal with something that you can tolerate, and be able to do this for about 2 minutes. So this is an easy way to get the outside of the elbow. Now to get the inside of the elbow, it's the exact same thing, just backwards. Now I just lay here, and then I just lay that kettlebell or dumbbell right on the side. I'm again squeezing the ball, and I'm just going through that range of motion. Each time, the progression for this is we're just trying to get that